Hi guys, welcome to this beautiful session on how stress leads to diseases. This is in collaboration with HealthQ Rehab and Heal Clinic. From HealthQ Rehab, we have Meghna Dave. She's a physiotherapist and she's dedicated her career to empowering physical rehabilitation in healthcare ecosystem. She founded HealthQ Rehab, which is a digital community and a physical rehab platform for people with movement-related disorders. Welcome, Meghna.
Thank you.
I'm Deepti, founder of Heal Clinic, where we work with emotional and mental wellness. We work with different energy healing therapies to see how we can find out the triggers, the emotional triggers, the event triggers, the beliefs which lead to diseases. And today we have with us Kavita Freedom. She has been in this space for more than 13 years now. She's an internationally certified and accredited workshop facilitator, therapist, and life coach, specializing in dealing with physical and psychological diseases. So welcome everybody to this platform. And without much ado, I will hand it over to Kavita to start this session.
Thank you, Dipti. Thank you, Meghna, for this opportunity. And yes, it is my favorite topic, how diseases can be seen from a different perspective. And before I go into the detail or anything to do with the diseases, I will give a little brief about myself. By qualification, actually, I'm an interior designer. That means the certificates say that I'm an interior designer. So what am I doing here as a therapist is a question which a lot of people ask me. And my journey started in 2001 when suddenly I could not walk and I lost my bowel and urine control. And I had to be rushed to the hospital where they told me that my L4, L5 disc is broken. It was not a bulging disc or anything. My disc had completely broken and I had to be taken for an emergency surgery. And I was still very new in Pune at that time. I didn't have friends, I didn't have relatives. So the first hospital that the doctor told us, we went over there. And what I call this as the universal signal, which I call it as the BPL, it is for the bump attack. It is when the universe completely changes the trajectory of your life. And my surgery went wrong, because of which I came down with CSF leak. I had seizures, and where I was completely immobilized on my left side. And that is when the doctor told me that the only option you have is another surgery. And I said, nothing doing. Whatever now has to happen will happen. There is something over here which I'm not aware of, and I really need to look into it. And that's when my journey of asking questions to the universe started, that if you have kept me alive, there has to be a reason. Because you could have very well taken me in that first surgery itself. Why am I here? And that is where I think the universe started answering me. Where first I came across a person who helped me deal with my emotions, things that were really coming in my way, because of which one by one I was creating diseases and health issues. And when I started working on it, actually, when I had gone to her, I had gone with 12 issues, including my CSF leak and my back issue and everything. And one by one, I started healing them. And within, I think, a span of 2 years, I was completely out of all my issues. My CSF leak stopped, my back healed, I was back on my feet, my insulin tolerance went away, my low blood pressure went away. Like that, many things, including psychological issues like depression, even that went away. And that's where I completely put myself into this study. One by one, I started studying different modalities, which has taught me, and through whatever I have learned, I have helped many people where without medication and surgery, I have been able to help them get out of the diseases. And the ones who are already on medication, I have helped them reduce their dosage to nearly one-fourth, which includes medicines of thyroid, diabetes, and depression, where normally we are told that once you start this medication, you have to take it all your life. So this is my brief. And 1 second. Dipti, do we go in for a PPT, or do you just want me to talk? How do you want to do it?
You can just talk also, or if you have certain PPTs, I mean, for making it easier for people for a visual.
Yeah. Okay. Now, normally, whenever there is a stressful situation, how do we respond? Anybody here would like to give me an answer? How do we respond whenever there is stress? Okay.
So I would say we don't respond, we react to stress most of the time.
All right. And how do we react?
It is multifolded, like for every individual the reaction is different, but yeah, I would say increase in your heartbeat or anxiety,
Yes.
panic attacks. These are some of the common things
So
that
these
you
are
might.
all the symptoms that
Right.
come in our body when we are under stress, right?
Right.
But when I say a response means what is the first thing that we do under a stressful situation? So what we do is these three things. We either fight, we either flight, which is run away, and the third, which I consider actually the most important one, is the freeze. And this is where the onset of diseases start. And how does the body register stress in our body? Everything that I see, everything that I hear, everything that I have felt, and everything that I think and taste or smell in that moment of stress gets all registered in my subconscious mind. And they all contribute to the disease. So let's take an example over here. Let's say you're walking on the road. You're wanting to cross the road. You're waiting patiently for the traffic to pass by so that you can cross. And there is a mother and a child next to you who are not waiting. The mother is in a hurry and she crosses. And from far, you see a red color Maruti come, bangs into her, and on the spot, the mother dies. The child is still there, and the car has gone and suddenly screeched to a halt. People are gathering around the whole scene. There is a lot of screaming, shouting. Somebody is wanting to call the police. Somebody is calling the ambulance. Would you say this is a stressful situation that you are experiencing in that moment? Yeah. What is it that you have seen in that stressful moment which can become a trigger for you later on? A
Death.
mother with a child, a red color Maruti, that road that you were trying to cross, that is all your visual trigger. What is your auditory trigger over here? The sound of the screeching car, the way it halted, the way people are speaking, अरे जिंदा है क्या, मर गई क्या, police को बुलाओ. All these now become your triggers because you have frozen in that moment. You didn't leave from there, you didn't fight, you froze in that moment. And at that time, anything that you think, or let's say you make a belief, I will never cross this road again. I will never sit in a red color Maruti car. They all become your beliefs, which also are your trigger. The smell of the petrol at that time, or the smell of the blood at that time, that will also become a trigger for you. So next time when you go through these things again, they will keep reiterating the disease that has already set in your body at that time. Now, actually, if we go to see, I always tell all my clients, don't curse your disease. It is trying to tell you something. It is making you aware that you have gone through something that your body, your mind, your heart has registered. It's just that you are not aware of it. So depending on the personality of the person, certain senses are more strong than the others, ones which will become their personal triggers. Okay, I'll skip this part. Now, for anything, for it to become a disease in your body, that way we see so many accidents, right? Not all accidents are going to become a trigger for you. Not all accident is a trauma also for you. So when is a trauma going to become a disease? That is also very important to understand. So for any incident to become a trauma or an emotional stress, the following 4 criteria have to be present. Even if any one of them is not there, it will not be a trauma. So the first thing is, it is something that has never happened to you before. So the example that I gave you, maybe you've never seen an accident like this or a death like this before. It is the first time you're experiencing it. Another classic example is sexual abuse, domestic violence. All these are traumas that your body is constantly registering. The second criteria, there is a lot of emotional energy to it. People are crying, people are screaming, shouting. In simple words, what we can say is there's a lot of drama around it. The third thing, you feel very lonely as you cannot share it or express it to anybody. Like, for example, the way I said, sexual abuse or domestic violence. Are we able to speak openly about it? No. And because we can't share it with anybody, we can't talk about this with anybody, we feel very isolated and we don't know what to do in that situation. So when these 4 criteria are there, 100% a disease is going to become. So these are some examples that can be considered as a trauma: a divorce, separation of parents, child getting bullied, you being shamed in front of people, an accident, a secret that you're carrying, maybe a family secret, personal secret that you can't share. These all can start a emotional, a conflict related disease in your body. Whenever an individual experiences a trauma, there are 3 parts of the human body that get affected. The first is always the heart. No matter what, the heart will get impacted. Why? Because we are feeling people. There are a lot of emotions attached whenever we are going through the stress. The second is the appropriate brain layer that is the best suited to deal with that stress. And the third is the related body organ, which is the best prepared to deal with that situation. And that is the reason you can say, why does diabetes go only to pancreas? Why not to the kidneys? Or why does a stone end up only in a gallbladder or in a kidney and not in the heart? Because each organ has a specific emotion that it deals with. So when that emotion comes under stress, it is that part of the body that gets affected. Is everybody there with me so far? And now, as Meghna had said earlier, there are 5 stages of a disease. The first one is your stress phase. Actually, the first is the trauma. Then the trauma gets converted into your stress. Then you come out of the stress, which is the rest. Then there is a healing crisis, and then you go back to your normal health. So no matter who it is, whether a child, a man, woman, young, old, we all go through these stages of a disease. Take a simple example of your periods. The time till your ovulation, is it stressful or restful? Is it stressful or restful?
Restful.
Sorry?
Restful.
Restful?
Yeah.
Then just before your periods, you go into your PMSing and everything. Again, there is stress.
Yes.
Body gets start filling up with water, bloating is happening, cramps are coming, correct? Again, you're moving into rest. And finally, when you get your periods, it is healing crisis. Healing crisis is when the body will pump out all the excess water, blood, mucus, your excess hormone secretion out of the body. So when I do a therapy and a client calls up and says that I've started vomiting or I've started with loose motions, I know the therapy has worked because the body has gone into the healing crisis. And then it goes back into the normal phase. Now, what are the symptoms of stress? Your body is tense. You're constantly in a cold body. Your extremities will feel cold. Like, it's even if you're feeling completely warm, or even hot maybe, the tips of your fingers, your toes, they will feel cold. You are into obsessive thinking. What does this mean? You're constantly searching for a solution. How do I deal with this? How do I deal with this? That is when high blood pressure comes. High blood pressure, diabetes, thyroid, they are all stress related diseases. And many times you may have noticed you're actually going just to get your regular blood work done, your 6 monthly or yearly checkup, and suddenly the doctor is going to tell you, oh, you have high BP or you have thyroid. These are those diseases that will not show up in your body that easily. There will be sleeplessness there. Even insomnia will set in many times. Your blood vessels are contracted. There is a complete absence of appetite in your stress phase. And even if you feel hungry, you are doing stress eating. So at that time, you will pick up high carb, high sugar food. That is the time when you want your pizzas, burgers, vada pav, and all that. And you have nervous, cold perspiration. And there is a loss of weight if you're not eating at all. Now, once the body is out of the stress, these are the symptoms of rest. Suddenly, you start feeling very fatigued and tired. This, I can give a very simple example here. You have a presentation to do, and maybe your boss has just given you 4 hours to prepare for that presentation. Will you be in stress or rest? Obviously, in stress. That in 4 hours, you have to prepare a presentation for maybe 10 people or whatever. You sit there sipping coffee after coffee, tea after tea, not sleeping, not taking a break, and you finish your work. What happens once the PPT is given, the presentation goes well, and you're applauded for that? You go into the rest phase, right? And that is when your body crashes. Many times have you realized so many people go on the vacation and they fall sick? That is what actually happens. You've moved away from the stress, gone into the rest, and that is when the fatigue and the tiredness comes in. And chronic fatigue syndrome typically happens when you've constantly jumped between stress and rest, stress, rest, stress, rest. Then one day, finally, your body says, okay, enough. Let this person constantly be in this stress or in this rest. Here, you will have low blood pressure. There's a lot of water retention and bloating in the rest phase. Why does that happen? That typically happens because we need water to survive. And in stress phase, a lot of us also feel very unsafe. And that is when water starts filling up in your body to make you feel safe and to help the healing process. Perspiration, hot skin, and body. During this phase, your appetite is really good. You're being able to digest food well. You feel hungry. And this is the time when you don't want that high carb, high sugar food. You want maa ke haath ka ghar ka khana. Your blood vessels go wide. There is weight gain. But this weight gain may not necessarily be only because of food. It will also be because of the water retention. Your heart rate will slow down, warm body and extremities, and you may also come down with fever. And the symptoms of healing crisis, as I said, throwing out of excess blood, throwing out of excess mucus, throwing out of excess water. All this is the body's healing crisis, even muscle cramping, because the body is doing that action of squishing out all that excess stuff that it has produced. Okay, so this is a brief about what starts creating diseases in your body. Does anybody have any questions here? Nobody?
You could ask general questions or even specific to any illness or anything that you're facing or someone close to you is facing.
So again, as I always say, even on talks or at Heal Clinic, either you all have understood everything or you've not understood anything. So I hope
it was very informative, very new for me as well. So a lot of things I also got to know, a different perspective.
So what kind of clients do you get most of the time, Meghna?
We usually get people suffering from neuromuscular disorders, where one of the most commonest one is facial paralysis, right? So Bell's palsy, yeah,
Okay.
it has a lot to do with stress. And when people go through this, so suddenly what happens, when your face is paralyzed due to a
Yeah.
viral infection,
Yeah.
which affects your facial nerve around the ear, right? Due to which your one side of face gets paralyzed. Now there's this 3 months of time frame when the inflammation from the nerve is getting out and the nerve is slowly coming back to its routine shape. Okay, but the speed, like from a natural speed of this nerve, is just 1 mm per day. So it takes usually 3 months for a person to get out of it. 95% of time people will recover completely out of it, but 5% of time people are left with residuals. Okay, and one of the most devastating is called as synkinesis.
I'm sorry, your voice got cut. Could you repeat what you said? The last part?
Recover are left with one kinesis.
Did you get her?
Meghna, you
Sorry.
froze in the end part.
Okay.
Yeah.
How about now?
Yeah.
Yeah. So I was saying that 95% of time people recover completely out of facial paralysis, but 5% of them are left with a residual which is called a synkinesis. Okay. So what happens is, we use our face naturally. We never put force and think and do facial movements. Suddenly, when you get this Bell's palsy, right, your nerve, the one is your motor nerve, which is the facial nerve, right, which causes the muscle contraction. But the other is your sensory nerve, which is called a trigeminal nerve, which sends all the sensory signals to the brain. So it is constantly sending this message to the brain that this side of the face is not working. Now, what the brain registers due to this, that this side is not working, I need to send more power here. I need to release more neurotransmitters here, right? Because brain is absolutely fine. Nothing has happened to the brain. The problem is in here, right? So now brain starts sending more and more signals. On top of it, when person get this, right, and it can happen at any age. So it is a very panicky situation. You're all well. Suddenly one day you wake up in the morning with one side of the face not working at all. Okay, now in this situation, the person is panic, not knowing what to do. So he unfortunately gets wrong advice, like you should do more facial movements, more exercise on the face. Now, what they do is they try to do every facial movement in a very forceful manner because this is not moving, they're pushing it. So the face starts taking help from the other muscles, which are used. Now, when this is happening for 3 months period of time, 4 months period of time, in a very consistent basis, face develops other different facial patterns. Listen. So, for example, if let's say a person trying to close the eyes, there would be automatically mouth movement happening, whether he wants or not. If somebody does this, automatically there would be some mouth movement. So all kind of weird movements start happening on the face, and these are all involuntary. More and more. The same where person is resting, feel majority of time deal with these kind of cases.
Okay, so Meghna, picking up everything that you have said, this kind of a client was to come to me, and I did have somebody with a facial paralysis, and the person was absolutely healed. You said something very interesting. One was here, the trigeminal nerve,
right,
one side of the face. Okay.
Right.
Now, from the emotional conflict point of view, I would ask this person, what is it that you have heard where you felt you could not show your face to anybody?
Right.
And that is the conflict of that person which has started this whole facial paralysis.
Got it.
And again, whenever anything to do with nerves is concerned, it is to do with communication. And that is the reason I said something that person has heard and has not been able to reply back, where they feel that they cannot show their face to the world. And when I had picked up this conflict for this particular person and worked with it, she had become completely fine. And yes, that does not mean that she didn't require physio or she didn't require medication. All that was going on. But because she resolved the emotional conflict, the healing was much faster.
Right. So even as I said, right, it has a lot to do with your facial expressions. So
Yes.
when a person suffers from the residual, we majority of time deal with the residuals, which is synkinesis, right? So even the emotional trigger, like if somebody is not doing anything on the face, but thoughts are going on inside the head,
Yeah.
right? Even they are dreaming. At that dream time, also, if the dream is bad, they have this facial expression which due to which they wake up in the morning due to a lot of tightness on the face. So that's one thing that impacts. So there is a lot to do with your emotional health and emotional well-being when it comes to resolving facial paralysis or synkinesis in general. And most of the time, majority of the time, we have also seen that there has always been a stressful situation that has been linked to the episode of facial paralysis.
Exactly.
Right. And it could be like we have patient who had an exam. There was a patient who got facial paralysis on the day of her wedding. Like she was just about to go for her wedding ceremony and she developed this. So we have literally very different type of stories to share about on this. But in most of the cases, there has been a trigger, an emotional stressful situation that led to this problem.
Yes. And that is exactly like is my job, that if you find out that specific emotional
Right.
trauma that has, happened just around that disease,
Correct.
you can really help the person come out of it
Mhm.
much faster.
Right, right. No, no, absolutely. I absolutely agree to that part.
Yeah. I think one disclaimer to all our listeners who are here right now, who will listen to later, is whatever we're discussing, it doesn't discount the fact that you need to go to a medical doctor.
Yeah, yeah,
You have the
absolutely.
treatment, you need the medicines, you need the physical rehab and the emotional rehab. So we are talking about working in conjunction with everything. Because a lot of times after listening to such sessions, people come and say, "Acha, but abhi mujhe doctor ke paas jana nahi hai." No, you need to go to a doctor,
Correct.
you need to get diagnosed, you need to get on a
Correct.
treatment.
Very true, very true.
So
Everything
many
works
times,
hand in hand.
many times people will just give a call and say, I have these symptoms, I think I have this problem, can anything be done about it? And even there I'm very clear, please first go to the doctor, get a test done, see, get me a diagnosis, and only then I can do whatever I have to.
Correct.
And again, I mean, as Diti is aware, my first session is always a complete case study. I need to know what has happened in your life around that disease for this disease to start, because that is our starting point.
Correct.
And where we are talking even about medicines, people who come to me, even who are on antidepressants, anti-anxiety, we never tell them to stop their medication. Therapy goes on, medication goes on, but because they are improving with therapy, the doctors themselves start reducing the dose.
Correct. So it's all about integration of different things, right?
Absolutely.
It is not that one size fit all approach that will work. That
Yes.
one thing only would be helpful for everyone. We have to keep patient at the center,
Yeah.
see what is the problem, and find the best solution for that patient.
Yes.
That should be the core motto behind everything.
Perfect. And I think that's the reason why we are also having this discussion, which is a collaboration, because we are looking at how each person, when especially you face something, you need different aspects.
Correct.
Because each person is different. Each person is different. So someone needs more of physical rehab, someone needs more of emotional rehab, but everybody needs a percentage of everything.
Correct. True.
And if you're looking at reducing our dependence on medicines in the long term, that is when companies like Heal Clinic and Health Q Rehab, we all come into picture. Because what we are trying to say is something I think that Meghna had told me sometime back about health literacy. I love that term.
Right.
That there needs to be, people need to be more and more educated about how these, I mean, right now they're known as satellite services or ancillary services, but I think it's time that we all became part of mainstream healthcare.
Absolutely, absolutely. That's there. Health
So,
literacy plays a very crucial role. Education plays a very crucial role. If you educate someone about their problem, they start understanding the layers behind it, right? And they themselves start unfolding them. That what can be the right solution for me.
so anybody has any questions?
Yeah.
To any of us?
You can on your camera or mic, anything should be fine. It's okay if you don't want to show the face. Oh, Ziba has also joined. Ziba is also my patient. So great. Awesome to have her.
Anybody wants to know the emotional conflict behind anything that you people are going through?
All right. So I think if we can just give a small summary to the new joinees, then they might have some questions, I believe. If we can just give a small summary of thing.
Okay.
Yeah.
So, as a summary, what we have spoken till now is that uh, a very specific emotional trauma can start a disease in your body. And an emotional trauma is registered by what we see, what we hear, what we smell, taste, basically through the five senses. And these five senses can become a ongoing trigger for you, because of which you may find it difficult to come out of a disease. Now, there are five stages of any diseases. One is the stress, rest, the healing crisis, and then the body goes to the normal stage. There are certain diseases which are completely stress related, like diabetes, thyroid, high blood pressure, and there are certain diseases which are rest related, like water retention, bloating, gastritis, anything. And the reason that we are talking about this here is to understand that along with your physiotherapy, your doctors, your medicines, and everything, you also need to see what is that emotional conflict that has started a disease, which will help you get out of that problem faster.
My teammate has a question. She's just here. I'll just ask her to join.
So actually, like I have joined from my laptop, but I don't know, it has got mute. So hi everyone, thank you so much for giving such an insightful words. So I have one question for you, Kavita. Like we have a lot of patients with a post-residual Bell's palsy, and sometimes we may feel that whenever we go into their history taking and into their experiences of past, so till the time of stage where they have reached into such a chronic level of their own disease, so it becomes difficult for them to remember what has happened a day before on the same day, and what the steps they have taken post to that condition. So it was a difficult zone where the person don't remember anything. So at that period of time, how to decide that what sort of conflict you are suffering from? So how can we help them to memorize what are the conflicts which might they have been suffering from, or which may have affected this condition? So how we can conclude on it?
So, see, in my 14 years of therapy work experience, whenever a client says that I just don't remember what has happened, it basically means that person is still in that state of shock.
All right. Okay.
That's why they are not wanting to remember, or they have deliberately given that signal to the brain that I want to forget it.
Oh.
And that's why they will not give you the information.
Okay.
But the fact is that whatever happens in your body, because your heart, your brain, and your organ is registering it, so is your subconscious mind. All the information is there in your subconscious mind. So there is no ways that you can't get to that information, provided you want to get to that information. So many times it happens, even when I take a good 2-hour case study, so much information comes up after 3-4 sessions of therapy.
Okay.
Specifically, sexual abuse will come up at that time. Why sexual abuse? Because people have got so traumatized by that incident, they have chosen to forget it. And so it will not come up at that time. But when a few layers of healing has happened, then it just comes up when they're absolutely ready to deal with it.
Okay. Okay. All right. I'll now try to view all these points, and I'll help everything into this. And thank you for helping.
Most welcome. There is a question, I think.
Yes, there's a question.
Do you anything to tell about macular degeneration? Yes, retina degeneration in the eyes. So now, see, from the emotional conflict, if I were to see, I have come up with this way of breaking down the name of the disease. The whole story is there in the name of the disease. Now, if I were to see macular, and if I were to split that word, it is ma, kal, ar. It is a conflict that you have around your mother. Either you're not being able to see your mother, or you're not being able to see your mother the way you want to see her. And that is when the macular degeneration starts. Because again, retina is to do with your vision, eyes is to do with your vision. It is something to do with either you are not being able to see that person the way you want to, or you are wanting to see that person in a particular way. You have this set thing. My mother means she has to be like this.
So
Yes, I have had fortunately success even with macular degeneration. The person did not have to go in for a surgery because the healing started with the whole thing. The filling of the water and the retina started healing. So the doctor has put her on a hold right now that since it's healing, let's wait and see what happens. And that was exactly her conflict. Her conflict was with her children. The children want to see the mother in a particular way. The mother wants to be in a particular way. So that's the conflict.
all right, so I have a question for you again. I'll come back on facial paralysis because that's where we deal a lot. So many a times, a person who suffers from synkinesis, right, or facial paralysis, believe that I don't like to see myself in this way. How others are going to accept me, right? How others are going to see me, and that's why they stop going out in social scenarios.
Yes.
They stop talking to people. They stop stepping out. That those kind of negatively again impact, right?
Yes.
So what is your take on how you can help, or else how therapy can help from that perspective to bring that person at acceptance at first place that this has happened?
Right. You know what is the most beautiful thing about therapy? It gives you your wisdom. It helps you learn why this particular thing has happened in your life. Like in my case, when I broke my L4, L5 disc, there was a reason why I broke that disc. Because I was under a constant conflict. Do I get out of the marriage? Do I stay in the marriage? Do I get out of the marriage? Do I stay in the marriage? So two vertebrae, they were constantly under conflict and they squished my disc till I was ready to get out. Now, similarly, when a person has this problem of the facial paralysis, if you remember, I told you what is the conflict? They have heard something where they feel they cannot show their face to the world. So, anyways, that conflict is there inside them that I cannot show my face to the world. This now becomes an added excuse for them that now, oh, physically my face is also like this, so I can't go. So, the first thing that therapy will help them understand, why did you get into this place? And if they can resolve that and find their wisdom over there, then whether the residue is there or not, they will go out into the world and shine. Because that fear goes away.
Right.
I think basically what therapy does is it works in the underlying emotions and your beliefs and your fears. So once you're ready to face that, the illness becomes secondary.
Correct. I think we have Ziba who wants to ask a question. Yes, Ziba, hi. You can ask your question.
Can you
Ziba,
Need to unmute.
मैम देखिए, मुझे अभी ऐसा लग रहा है मैं हॉस्पिटल में हूँ और मेरे अभी मैं ओटी से आई हूँ, वही रूम में आई थी कल, लेकिन मैम देखिए ये बेस्ट पैल्सी का जो अटैक था, जो मेरे ज्यादा फ्लिकरिंग करता था, वो अभी वहां सब रुका हुआ है मैम, मतलब उतना ज्यादा इफेक्ट नहीं लग रहा है. तो ये ऐसे क्यों हो रहा है? और जबकि हम जो हॉस्पिटल से आए थे मैम, तो मेरे बहुत मतलब पहले बहुत ज्यादा था, अभी थोड़ा
कम लग रहा है.
हाँ मैम, अभी कम लग रहा है.
अच्छी बात है. आप रेस्ट अच्छे से किए हो, मतलब ठीक है, योर रिलैक्स, और आपका टीकेआर हो गया. शी जस्ट अंडरवेंट नी रिप्लेसमेंट सर्जरी. या सो अभी एक वो पीस ऑफ माइंड आपको आ गया, राइट? आपका जो नी रिप्लेसमेंट आपको करना था वो हो गया, एंड दैट इज हेल्पिंग यू टू फील मोर रिलैक्सड.
Okay.
Again, this is the classic case where she has shifted from the stress to the rest, and now the body is going into the healing.
Right.
Okay, ma'am.
See, I'll give you an example of a thyroid client. As you said, that even with thyroid, sometimes that residue stays. You know, the doctor, even though the thyroid is down, they will say for some time, please take the medication, and that's fine. But what is this residue? Why would it stay? If everything has been taken care of, the residue shouldn't be there, right? So when we start dealing with a thyroid client, What are the conflicts that we are looking at thyroid? It is a complete state of powerlessness where I'm not being able to speak what I want to speak and I cannot express myself. And the minute the client gets that expression in therapy and then in their real life, the thyroid goes away.
Right.
And then even the residue will go away until and unless it is re-triggered. And that's why when the therapy is done, all these things like what is it that you heard, what you saw, what you felt, we take care of all those aspects.
Any
Anything
other
else?
question? I think that was a lot of new information which most of the people got here. So they are still kind of thing. But yeah, but I think this is an important information for all of us to know, because most of the times, at least as Indians, we are trained to keep our emotions underneath. Press nahi karna hai, बोलना नहीं है, बड़े हैं, authority figure है. So, it comes out then in the most improbable situations, which leads to certain things.
See, I always tell people, जहाँ पे बोलना है, वहाँ पे अगर नहीं बोलोगे, तो वो निकलने तो वाला है ही, but it will definitely come out at the wrong time, the wrong place, and in the front of the wrong person.
Right.
So you express it in a positive way wherever you need to and however you need to.
Right, right. Very true, very true. Awesome. No, this was very helpful. I hope everybody everybody found a value in this, and definitely I found a lot of value. Right.
Thank you so much for this thing, Meghna. And like you said, I hope everybody who's here, they have found some value in it.
Right.
And yeah, if there's anything that further you want, or you have any questions, just reach out to Meghna or us or anybody, like wherever you're comfortable, and we are here. Yeah.
Thank you so much. Thank you, Meghna.
Thank you. Thank you.
मैम मेरा एक और क्वेश्चन है.
Yes,
मैम ये बताइए कि अगर हम जैसे अपना स्ट्रेस लेवल्स को खाली मेडिटेशन से तो आपने बताया था मैम कम कर सकते हैं, और कैसे कम करें मैम? क्योंकि यहाँ तो हम ये देख रहे हैं मैम कि दर्द मेरे बढ़ा तो हम जैसे अपनी वही ना स्पिरिचुअल दुआएं पढ़ने लगे, ये सब का तो हमें आराम हो गया, लेकिन फिर जब ध्यान गया अरे मेरी बॉटल लगी, दर्द हो रहा, तो मेरा दर्द बहुत बढ़ गया. फिर ये हो रहा है, इसका रीजन क्या होता होगा मैम?
हाँ जी, Kavita, if you can answer this.
See, the reason here is that जो कुछ भी आपको तकलीफ हुई है, उसके पीछे का जो इमोशन है, आपने उसके साथ डील नहीं किया है. So that's why when we do meditation, we get that temporary relief. We do prayers, we do chanting, we get that relief 100%. It helps, no doubt about it. But again, why does it come back? Because the attached emotion to it, that is not taken care of. Whether it is fear, anger, whatever it may be. Like somebody who's got diabetes since a long time, the first emotion that I have to deal with that client is of anger and disgust. It is years of anger and disgust that they are carrying, which is the result diabetes. And the minute that is taken care of, the diabetes also is being taken care of. In thyroid, it is powerlessness. In high blood pressure, again, what is the pressure that you're carrying on your head all the time? That's the question I ask them. Which of your blood relationships is giving you so much pressure? See, again, the disease, high blood pressure. Blood is your blood relationships. Pressure is, they are creating really a lot of pressure for you. And invariably, you will come to know, oh, I have in-laws that I have to take care of, and I'm not being able to handle it, or there is a financial situation, or there is a child that is not okay. It is a constant pressure on that person and a constant wanting to find a solution which gives them the high blood pressure. So it is, I mean, I can say, okay, my disc broke. Maybe somebody else's back is hurting. Why is their disc okay? Because their conflict is different. My conflict is different. The emotion they are dealing with is different. The emotion that I'm dealing with is different. And the best way to answer Ziva's question is, whatever you are feeling, don't suppress it. Acknowledge it. You don't have to go on the Eiffel Tower and tell the whole world I'm feeling angry with my mother-in-law or with my father-in-law. but at least tell that to yourself. That, you know, I'm so angry and irritated. I am feeling this emotion. Even just saying that much will start reducing the impact of that emotion.
Okay, ma'am. Thank you so much. My
Most
doctor has come, so I'm going for a therapy
Yeah.
again.
totally
Yeah.
safe.
Thank you. Bye-bye. Thank you so much.
Yeah, take care, Zeba.
And again, what I tell all my clients, your body does not do anything by chance. उसका mood आया और उसने तुमको high blood pressure दे दिया, it doesn't happen that way. Oh, I have, you know, randomly chosen out of 10 people, I give thyroid to 2, I will give diabetes to 2. It doesn't happen that way. There is a very specific reason why you have a particular disease. In fact, why even the left side of your body and why not the right side? There is a reason behind that also. Because the left side of your body is the feminine energy. Your mother, your children, and you yourself come on the left side. So if somebody's got paralysis on the left side, I would want to look at that. And all your other relationships come on the right side, which is your male energy. So even that will give you a lot of information. I'm sure you must be having, like, some people are having the paralysis on the just the left side of the face, some on the right side of the face.
Yeah.
Because if it is a common disease, everybody should have it on one side only. No, why not? So it is the conflict with that particular person which has created that even the left and the right. Husband said something which I was not okay with, right side. My mother said something that I was not okay with, left side. Anything else, anybody? All right.
Yeah. So then let's wrap it up for now.
Sure.
And thank you so much. Thank you so much, Kavita, for being here.
Thank you, Dipti. Thank you, Meghna.
Thank you, Meghna.
Thank you everyone for joining as well. It was pleasure, and it's really grateful that Ziva joined. Right, she's in. She just came out of her surgery, so she is our client and she takes regular therapy from us. So it was really nice to see her and hear from her. And hope everybody found value. Let's do this more often so that more people can get help. Yeah.
Definitely.
Thank you so much. See you.
I'll also send you the YouTube link because we have a lot
Sure.
of recordings
Right.
with Kavita and me on very
Right.
specific ailments.
Right.
Like we have an insomnia, PCOD, IBS, thyroid, diabetes.
Sure.
So in fact, if you want on specific illnesses, that's something that we can do a short recording for, like, 10 to 15 minutes.
Sure.
What are the conflicts behind that, and then send it across.
Yeah, definitely.
Yeah.
Yeah. All right.
Thank you so much.
Bye-bye.
Bye.